Up to a third of women experience debilitatingly heavy periods. This can cause significant disruption. It can also lead to depression, time off work, and in severe cases, even lead to a low blood count or anemia. Currently, heavy periods are treated hormonally or surgically, but these options have side effects and can affect fertility. So is there a better treatment? Edinburgh University's Jackie Mabin thinks so.
We were looking to see if we could find the reason why women have heavy periods. And we looked at biopsies from the lining of the womb in women with heavy periods versus those with normal periods. And we found that there was a protein that was significantly decreased in the lining of the womb of women with heavy menstrual bleeding. And that protein was hypoxia-inducible factor. Now, when the lining shed, it leaves a denuded surface. And this has to repair really efficiently to limit menstrual blood loss. And this protein, hypoxia-inducible factor, coordinates that repair process. So we felt that women with heavy menstrual bleeding had less of that protein and they bled for longer than their normal counterparts.
This protein, hypoxia-inducible factor, triggers the womb lining to repair itself after the bleeding involved in a period. To find out how, the Edinburgh team looked at menstruation in mice. In their animals, the protein only worked properly when the levels of oxygen were very low. This is called hypoxia.
These mice needed very low oxygen levels within the lining of the womb during a period to trigger the repair process.
It turns out that a lack of oxygen stabilises the protein hypoxia-inducible factor, which is able to then get on with repairing the womb lining, spelling the end of a period. It could be that women who suffer from heavy periods don't create the correct hypoxic conditions in the lining of the womb to efficiently activate the repair mechanism. Blood vessels in the uterus, the team think, might be to blame.
Certainly there have been other studies done that have shown that perhaps the blood vessels aren't able to vasoconstrict, so narrow at the time of a period in the same kind of way in women with heavy bleeding, which means they may have a lack of this hypoxic response and have higher oxygen levels during a period. And that might be the reason why they're not triggering this repair.
So is it possible to do the job of the hypoxia by some other means? The Edinburgh team have found a compound which can stabilise hypoxia-inducible factor, HIF-1alpha, as it's also known, in mice.
We took mice that had lack of this hypoxia or low oxygen levels, which mimicked what we think is happening in women. And we treated these mice with a compound that stabilises HIF-1alpha at the time of bleeding. And we found that this really improved the repair process, which we think is a first step towards a new non-hormonal treatment that women can take.
Sounds promising. So this drug boosted the levels of hypoxia-inducible factor in mice who had too much oxygen in their womb lining for the repair process to kick in as normal. But how does this drug work?
So the medication works by preventing the breakdown of the protein so that the protein's present even if there aren't low oxygen levels. So it means that even if the blood vessels aren't constricting and there's no hypoxia in the lining of the womb in women with heavy bleeding, then this protein, if you use the medication, would still be switched on. And clearly this would be associated with less hormonal side effects because it's not a hormone treatment. And we hope it would make women have normal, lighter periods.
So far, the team have only used this drug for this purpose in mice. What about using it in humans? For instance, people with heart conditions, DVT or stroke, could there be side effects to taking a drug which affects a protein that normally works in low oxygen conditions?
That's a very good question, and I think we have to be very clear when it's a new medication that we don't have all the answers yet, and the clinical trials do still need to be done. But theoretically, or taking a common sense approach, I think if you're able to just use the medication perhaps within the womb and limit it to a certain stage of the cycle, then usually side effects are limited in that way because you're using as little of the drug as you need to get as good an effect as you can. So I don't see that it would be a particular problem theoretically, but I have to say that we don't yet know the answers to those kind of questions.